You've broken a bone. Does it really matter how you've broken it? Why does that make a difference? Are your bones too thin? Are they fragile? Could you more easily break them? There's a condition called osteoporosis in which you have these more fragile bones. They're thinner than they should be compared to other people of the same age. I'm Dr. Banasali, rheumatologist and lifestyle medicine physician, and today we're going to talk about bones, and it can make a difference how you broke that bone. Let's talk about it. Based on the World Health Organization, osteoporosis affects about 20% of women over the age of 50 and about 6% of men worldwide. So this means that hundreds of millions of people have osteoporosis or thin bones and are more likely to break them. What can we do to pick this up? The most conventional way to check if somebody has osteoporosis or osteopenia is using a bone density scan. And it's also called a DEXA scan. You go in this machine, you lie down in it, and it kind of goes over you and it comes back. It's not usually a problem with claustrophobia. It's not loud and banging noises like an MRI, so it's actually not that bad for people who are scared to get it. And it's pretty quick. And what it looks at usually is your spine and your hips. So it doesn't really look all over the body. And I want to make that clear because a lot of people look at it and they're like, well, how is this area and how is that area? It doesn't really quantify that. It really is for the spine and the hips. And that's about it, unless you have a lot of arthritis in your spine. So then it makes it really hard to read and they may prefer using other areas. Or if you've had your hips replaced, like if you had your left hip replaced and they cannot use that spot to gauge how thin your bones are. Or if you've had your right hip replaced, they cannot gauge that spot to see how thin your bones are. So sometimes they'll maybe do the radius, end of the radius to see how thin that is. It's not as good a value that we like to look for osteoporosis to indicate if it's the same as the whole body, but it's something and it's better than nothing. So it's something. So we get a value that way. When you're in a DEXA machine, what it's looking for is to see really how porous your bone is, right? Osteoporosis, how thin your bones are. So that's a good way to measure how thin they are. Is there any other way though? There is. Actually, if you get a fracture, you break a bone and you should not have broken it, because if you compare yourself to somebody who was maybe 25 years old and they wouldn't have broken it, you need to take a pause, take a step back and say, could this be something called a fragility fracture? Which is kind of what it sounds like. Your bones are fragile and that's why they broke. They should not have broken, but they broke because of that. So the most conventional way to diagnose osteoporosis or osteopenia is a bone density scan. However, there is another way to diagnose it. If you have a fracture, if you break a bone, which you should not have broken because you were not really doing anything that exertional that should have caused it to break. That's the other way. I know the term fragility fracture is new to some people, but I think it's really important to know because we're not apparently treating thin bones very well. About half of all women and almost a quarter of men will experience a fragility fracture in their lifetime. That's a lot of people. And remember, it most commonly affects the spine, the hips, or the wrist, which is why those areas are generally measured. But it can be in other places as well. So let's look at another example. Let's say you unfortunately get in a car accident and you break some bones, which is entirely possible. If it's at a high-speed car and it hits something or somebody hits you, yes, you can break a bone. Or if you fall off of a building, a fourth-floor building, can you break a bone? Yes, it makes sense. But if you're walking down the street and you step off a curb and you fall, you probably shouldn't break anything unless it's a really odd way to fall. Most people wouldn't. But if you did, you have to wonder, is this a fragility fracture? Who's at risk for osteoporosis or these thin bones? Well, women more likely than men, especially over the age of 50, smokers for sure, or if somebody's been giving you a lot of steroids, corticosteroids, like I do, because I'm a rheumatologist, so I do prescribe a lot of steroids, that is a risk factor for having more broken bones. Even people who have asthma, long-term asthma, and they're always getting prednisone, steroids by mouth especially, that's definitely at a higher risk. But people get steroids for all kinds of reasons. So those are definitely something that you have to be careful about. But also family. If your parent had a hip fracture, you're more likely to get one. Definitely a risk factor. Poor nutrition. If you're not getting the right nutrients, calcium, vitamin D, and other ones, then you're more likely to break a bone. Low body weight. People that are thinner tend to have more likelihood of breaking a bone. Chronic inflammation. And for those that have autoimmune diseases and they're chronically in a state of inflammation, that inflammation itself can lead to more risk of breaking a bone. So it's not just the medications like steroids, or even chemotherapy if you have cancer, that also can increase your chance of breaking a bone, but also the state of inflammation itself. And there are many other medications also that can cause it, including a very common one that many people have, which is for acid reflux. Even that medication can thin your bones and give you a higher risk of breaking them. This is a common list of medications that many people take. And if you need to take them, then you should, but talk to your doctor about whether it is necessary long term. If you have a bone density scan, which is the type of imaging that we use to see if somebody has osteoporosis. And let's say you get this scan and it shows that you're only osteopenic. So you have thin bones, but they're not super thin to the osteoporotic range. But then you have a fracture. You break a bone and it was a fragility fracture. You were doing nothing. Let's say, for example, you had gone for a CAT scan because you had an asthma attack or a bronchitis attack and they wanted to check your lungs, and on that they saw that your spine had a little deformity and it was a fracture, and that is what we call incidental, but that's a fracture. If you had it for no reason whatsoever, nothing hit you, you weren't in an accident, and it just happened. So that is called a fragility fracture. And honestly, almost 2/3 of fractures in your spine, these little wedge deformities, are silent. You may never know you had them until you find it when you're looking for something else. That's scary because that also means you're at a higher risk of another fracture. Not only that, you are no longer called osteopenia. You are osteoporosis once you have a fracture like that. So even if the scan says you don't have it, but if you have that type of fracture, you have osteoporosis and you should be seen for that. So please seek help from your healthcare team and find out why you had that fracture, right? If it doesn't make sense, you need to know. Now, a lot of people have heard about hip fractures, spine fractures, hand fractures. Where do you think is the most common fragility-related fracture? Where can that happen? Where's the most likely place you'll break a bone when you have a fracture from osteoporosis? I'm giving you a pause here, but it's actually the spine. Those vertebral fractures that I was just talking about. So you have to be careful. An important point, if you have had one of those fragility fractures, let's say that spine compression fracture, are you more likely to have another? Yes. That's why you need to get looked at and figured out why you have that, because we have medications for this and we have exercises that we suggest for this. So there are things you can do. If you've had one fracture, you're more likely to have another. So definitely get evaluated. Where are the common spots to get these fragility fractures? Well, we talked about the spine and the hip, but also right over here in the radius. That is a spot that you could get a fragility fracture, or even up here by your humerus, right? There also is a spot where you can get a fragility fracture. If you break your nose or a rib, it's less likely, but it could be there. Sometimes you can get a fragility fracture just by sneezing. And as scary enough as that is, that means also you need to be evaluated. Bottom line, it does matter how you break a bone, because that could help us tell you whether you have osteoporosis or not. And if you do, if you have these thin bones, then you should get evaluated because there are treatments out there. Dr. Banasali, if you learned something from this video, if you know somebody who has thin bones at risk for fragility fractures, or if you yourself have them, then please follow along and subscribe, and I'll see you next time. We'll talk about treatment and prevention.